I want to start with a case update for the ACT. We do have one new case of COVID-19 in the ACT. This case is not associated with the outbreak in New South Wales. This is a Commonwealth official who has returned from overseas, a female in her 40s. And she's currently in quarantine in a hotel being supported by ACT Health. Dr Coleman will have some detailed information in relation to some new directions which will be signed later today, which do relate to the New South Wales situation. And she will also be able to provide some further information on the new case should people be interested in that one. So we know that the New South Wales situation is rapidly evolving, and we've seen both New South Wales and other jurisdictions responding to that today, and the ACT is doing likewise. We know that there are 68 confirmed cases already linked to the Northern Beaches cluster, and we also know that cases have been identified outside the Northern Beaches local government area. And so the Chief Health Officer will sign a public health direction tonight with new quarantine arrangements coming into place from 11:59 p.m. this evening, tonight. For any ACT resident who has been in Greater Sydney, including the Central Coast, Illawarra Shoalhaven or Nepean Blue Mountains, you will be required to undertake a period of 14 days of quarantine on return to the ACT. If you are from this area, and you are not an ACT resident, please do not come to the ACT. We're working to update the ACT Health website with all of this information, but the key information is for ACT residents who are returning from the Greater Sydney area, which is being defined in the same way that New South Wales is defining it, in the same way that other jurisdictions are. So Greater Sydney, including the Central Coast, the Illawarra Shoalhaven and Nepean Blue Mountains. If you're an ACT resident returning, you will be required to undertake 14 days quarantine if you return after 11:59 p.m. tonight. If you are not an ACT resident, please do not come to the ACT. This will be managed through a declaration process rather than a permit process, and information will be available on the ACT Health COVID-19 website for anyone who needs to make a declaration that they are returning to the ACT, so that we understand how many people are involved here. So please keep an eye on the COVID-19 website and on ACT Health social media to stay up to date. The other thing that I would like to say to ACT residents is please reconsider your need to travel within New South Wales. This is not a situation that we wanted to see at this time of year, and we said that in relation to the direction that was issued a couple of days ago in relation to the Northern Beaches area. So it's a reminder for those people, if anyone has been in the Northern Beaches since the 11th of December, you are already legally required to be undertaking 14 days of quarantine from the time that you left the Northern Beaches area. That direction remains in force, and this is an important reminder for people. But if you have been in this wider area of Greater Sydney and you return to the ACT from 11:59 p.m. tonight, you will also be required to undertake that 14 days of quarantine. If you are not an ACT resident, please do not come to the ACT from this area. We're also seeing other jurisdictions updating their travel advice and their legal directions in relation to Greater Sydney and New South Wales. We've been working with the Chief Health Officers and Ministers, and indeed at Premier and Chief Minister level with other jurisdictions to understand what that means for ACT residents. I can go through that if people are interested in relation to some jurisdictions, but I would really encourage anyone who is considering travelling to any jurisdiction in Australia to have a very close look at their website and keep an eye out for any announcements that they may make. Many jurisdictions are perfectly reasonably treating the ACT as if it is part of regional New South Wales. Some are not, And so it is really important that you look at the website information and the public health information for the jurisdiction that you are intending to visit to understand what restrictions may be in place. So with that, I'll hand over to Dr. Coleman to talk more about the direction that she'll be signing this evening and the directions that will be in place from 11:59 p.m. today.
Good afternoon, everyone, and thank you, Minister. As you may know, I am Dr. Kerryn Coleman, the ACT Chief Health Officer. Unfortunately, as many of you have seen over the last few days, we continue to see cases in New South Wales being identified. There have now been 68 confirmed cases linked to the Northern Beaches cluster, as reported by New South Wales Health this morning. But concerningly, we have seen transmission events taking place in Greater Sydney, that is outside of the Northern Beaches LGA. As a result, from 11:59 p.m. tonight, the ACT will have new quarantine requirements for anyone from Greater Sydney, Central Coast, Illawarra, Shoalhaven and Nepean Blue Mountains. I will be signing a new public health direction later tonight to make these arrangements legally enforceable. What we are trying to achieve here is to prevent seeding of the virus any further. For this reason, the ACT will be effectively closed to people from Greater Sydney and these surrounding regions. For the purposes of this new direction, Greater Sydney, Central Coast, Illawarra, Shoalhaven and Nepean Blue Mountains will be the same as the area covered by today's new public health orders in New South Wales, where community restrictions are being tightened to try and prevent community transmission in the event of seeding. A more detailed list of locations affected will be available later tonight on our website. So if you are not an ACT resident and you have been in any of these places, our message is simple, and I will reinforce the Minister's message: do not travel to the ACT. If you come to the ACT, you will be required to quarantine, and anyone staying at the same premises or house as you will also be required to quarantine. Returning ACT residents will be able to quarantine at home and will be supported by ACT Health. This is not about stopping ACT residents coming home. ACT Health will not be considering exemption requests for non-residents coming from these regions, except in extreme extenuating circumstances. So to implement this, all travellers from Greater Sydney, Central Coast, Illawarra, Shoalhaven and Nepean Blue Mountains will be required to notify us in advance by completing an online declaration form. We are hoping to have this form up later this evening, and it will be available and running by midnight tonight. I do understand that this will be difficult for many people, and definitely don't take these decisions lightly. While we will not have these restrictions in place any longer than we need to, we need the community to be prepared that this is likely to continue over Christmas and potentially into the new year. Ahead of this new public health direction coming into effect tonight, I'm reminding everyone of the existing public health direction which applies to the Northern Beaches. So just to remind you, anyone who has visited the Northern Beaches area from Friday the 11th of December 2020 is legally required to quarantine for 14 days from the date they were last there and get tested even if you don't have symptoms. You must stay in quarantine for the full 14 days even if you have a negative test result. This is important because these are the people who are at greatest risk of being exposed to the virus within the Northern Beaches region. In addition to the new public health direction for the ACT, as the Minister has discussed, other jurisdictions have introduced new travel restrictions from people who are from or have been in Greater Sydney. If you are in the ACT but have recently come from Greater Sydney or surrounding regions and wish to travel to another jurisdiction, you may not be able to do so. So you will need to visit the website of your destination jurisdiction for accurate advice on whether you will be able to travel or not. We will be taking further steps to strengthen our support of this national response with ACT policing and Canberra Airport checking people's residential addresses to ensure people are not attempting to circumvent the border restrictions of other jurisdictions by travelling via the ACT at the airport. This work with the airport will assist us in keeping other jurisdictions open to ACT residents travelling. We have also seen demand for testing being very high over the last 24 hours, with 999 tests being recorded in the last 24 hours. We ask those impacted by this direction to immediately quarantine, organise their testing for later in the day and be patient with staff at our testing clinic. We thank everyone for coming out and getting tested appropriately, but please be patient and treat our workers with respect. They're all trying to do their job. We also have information on our COVID-19 website on our testing clinics and their times of availability. And just lastly, I know we've heard this a lot, but this is a rapidly evolving situation and we will have information as available as it comes to hand on the website.